So for stoma site marking, we need to identify our classic anatomical landmarks, the anterior iliac spine, the pubic tubercle, and the umbilicus. This outlines the classic stoma triangle. Next, we need to identify the lateral border of the rectus. So we ask the patient to lift the legs, and we define the lateral border of the rectus abdominis muscle. So you need to site the stoma within the lateral border of the rectus abdominis muscle so that there is decreased incidence of peristomal hernia later on. So again, defining the anterior superior iliac spine, the pubic tubercle, and the umbilicus. This is followed by defining the lateral border of the rectus abdominis muscle. So you need to stay within the stoma triangle and within the lateral border of the rectus abdominis muscle. So resuming the procedure, I mark a potential stoma site, aiming for at least 5 centimeters distance from the umbilicus, the midline, and the bony prominences. But standard marking in supine position is only half the job done. So we ask the patient to sit up after marking the initial site for stoma, and over here you can notice that the initial cross marked site completely disappears within the natural skin fold. So this would lead to poor pouch adherence. So we mark another sites 5 centimeters away from the skin folds in the right upper and the lower quadrant. So clinical evaluation does not stop at visual inspection. Upon deep palpation, I detect a firm underlying rectosigmoid mass that is situated directly beneath our newly marked sites. So I'm going to abandon the stoma triangle altogether. So I had already asked the patient to sit up, to bend forwards, and to stand up, and then I had defined a potential site for a stoma that is 5 centimeters away from all of the skin creases and from the tumor itself. So again, you need to identify the anterior superior iliac spine. You need to identify the umbilicus and the subcostal margin, along with the potential skin creases and any bony prominences, along with the midline and the previous scar marks. So you need to maintain at least a 5 centimeter buffer from all of these structures to guarantee a flat surface for the wafer. So this slide summarizes the steps of marking a stoma site. Save it for the next time you're on call and don't have the luxury to access the stoma care nurse.